Welcome, everyone. Thank you for coming out today. I'm sure everyone's starting to hear a little more about this precision genomic medicine and how important it is for how it can help doctors better precisely treat our patients. So I'm going to go through a quick presentation on this. I've been in practice for over 20 years and have recently introduced the genomic testing into our concierge practice within the last couple of months. And it's something that I think is going to be more evolving in the medical field. It's already being used in many different aspects of medicine. So what exactly is this precision medicine? Well, it is a way that we are able to manage patients based on their unique genomic makeup. Of course, environment and lifestyle comes into play when we're talking about hereditary cancers or even diseases. But we will focus heavily on human genomics. It's been used in preconception for counseling, during prenatal, newborns for screening for hereditary disorders, in children, and adults we're starting to use for cancers as well. Little facts about genomic testing. 7% of all hospitalizations are due to adverse drug effects that could have been prevented by knowing the genetic makeup of an individual. 30% if you are over the age of 65. 99% of people have something genetically based for a drug response, meaning that we can look at your genomics and precisely tell you how you're going to react to any medication. 10% of us have some kind of genetic makeup that's going to predispose us to some kind of genetic disease. So going back to high school genomics, we have trillions of cells, one genome. We have DNA sequences, 34 nucleotides per sequence. The human genome is 3.2 billion base pairs. So it's phenomenal to think that we can sequence something this long, right? There are other things that come into play with our genetic makeup and whether we're going to have any kind of cancer or predisposition for disease. Take for instance our diet, smoking, medications that we're put on, the Petri dishes, for example, of infections, exposure to radiation, or even sunlight. So any of these factors can influence regulatory molecules that can turn on or off a gene, and that can affect whether we will have a certain disease or even predisposition for a cancer. A good example is diabetes. Sometimes diabetes can be solely lifestyle that increases your risk, or it can be what we call Mendelian, meaning that you are born with the genetic mutation, and that genetic mutation has a high predominance of exposing itself and an expression that you will have the disease. Or it can be multifactorial. Type 2 diabetes we know is hereditary, but if you're overweight or your diet is high in certain fats, it can increase your risk for diabetes. Let's talk a little bit about genetic testing. A brief history about genetic testing. The first person to discover DNA was back in 1871. In 1953, we all learned this in high school, at least I did, so I'm suspecting almost everyone did too, because I'm older than some of you. Watson and Crick discovered the double helix. Then in 2003, there was something called the Human Genomic Project, and it was completed in this year. It took billions of dollars to complete. It took several years to complete. So that's just one human genome. In 2007, I put the iPhone there. The iPhone came out, just so we know how everyone can relate to the iPhone. In 2008, next generation sequencing was invented. Next generation sequencing is what makes genetic sequencing less costly and more available to the general public. Cost of genetic testing has gone down for two reasons. First one is like what I told you in the previous slide, because of the invention of next genetic sequencing, which we call NGS. And also there was a Supreme Court DNA patent ruling that said that that a DNA cannot be patented. We won't talk about the company. There was one company who had a patent on DNA sequencing. It cost $3,000 per individual to have it done. When the Supreme Court stated that you can't patent a DNA because it's been beneficial to everyone, the cost for DNA testing has dramatically decreased. So you can see how it costs billions. Actually, it says millions up there, but it was billions. And now we're coming into the $1,000, $1,200 range. There are over 75,000 medical tests on the market for DNA sequencing. They are used in many fields, prenatal, like we talked, cancer, for oncology treatment, for pharmacogenomics, in pediatrics, neurology. We even use it in cardiology. There's like an apoprotein E. If you have that gene, that increases your risk of high triglycerides. And in gastroenterology, we also use it for treatment. And as you can see at the very bottom, the blue, that is for disease risk. That would be someone like you who's just interested, who's healthy, just wants to get it tested. How does that compare to direct-to-consumer testing like 23andMe, Ancestry DNA, Xcode? Well, these are not medical grade tests. So what that means is if it does come back positive, you still have to go and get a medical grade test to confirm. It also is not complete and comprehensive. So it leaves several questions. If it's not complete, was I tested for, am I getting, am I truly clear of disease if it's showing negative? So that brings up a lot of confusing questions. So direct-to-consumer tests, these results again are not diagnostic. They may raise more questions than answers. They usually do not provide genetic counseling. There's confusion. It may misguide individuals to thinking that they're healthy when maybe the genes because only a small number of genes are tested, only a few genes are available for testing through the FDA through direct consumer testing. An example of this is 23andMe. I always use this because now they state that they test for breast cancer genetic testing. They're only testing for 3, although there are thousands. So an individual who comes back and says, my 23andMe said that I'm clear or I'm not at risk for breast cancer, may be misguided to think that they're not at risk. And it goes more into just genetic testing. It also is important to have your family history in conjunction with this. So what's my testing approach? So I'm going to be using labs that have been researched by myself and are at very high standards that I learned through my precision medicine training that I received. They're fully accredited labs. The genetic counseling will come along with this, as well as a thorough medical history review. It always starts with me as your physician. I will also coordinate any of these results with specialists. If something comes up that you need further testing with a cardiologist, we'll coordinate that care as well. And reports are clear and actionable. So we'll know what to do with those reports and you'll know how to proceed. I do want to bring up this warning. There is a law that was passed called Genetic Information Non-Discrimination Act. We call it GINA. It protects against discrimination in health insurance and employment. So what that means is that your health insurance and employer cannot use this to discriminate employment or from getting health insurance. However, there's always a however, there are currently no exclusions in the law for long-term health care or life insurance. At this point, they're not using it for long-term health or life insurance, but we can't say that they may in the future, so we warn you about that. So let's talk a little bit about our program. We have 3 tiers, tier 1, 2, and 3. We start out with family history, and then tier 2 is the drug response or pharmacogenomics. And the last tier is comprehensive. It will include also all of the family history and drug response and much more. And we'll get into that in a second. So what's tier 1? That's the family history. For those of y'all who are part of our concierge program, we do a concierge wellness exam, which takes about an hour and a half. It's very comprehensive, and we start with your family history. So we do get a very thorough family history. We recommend that we get history on first degree, second degree relatives, type of disease, age of disease. The reason we bring up age is more likely to be genetic if it's at a young age where it presents for a cancer. Jewish ancestry, because there's a higher risk of certain cancers in the Jewish population. And then lineage, if it falls mainly through one line, that increases the risk as opposed to it being partly on the mother or father's side. A useful tool, this is, you can see this on my website and click and get on there directly, but it is My Family Health Portrait. It is put out by the CDC. It's a very easy tool to use. If you get tired, I started it, and it does take a while to get through it. So you start putting the information, and if you're tired, you can stop and you can come back and start where you left off. And you can send it to us as a PDF, and we can save it on your medical records, or we can go over it again during our concierge wellness exam. So this part is part of your standard concierge service, so that comes at no cost. We recommend that you get as much of your family tree, family history, because that is just as important as your genetic testing. Second tier is drug response. We're going to be looking to the way individuals, specifically each patient, responds to drugs. We have proteins that are made in the liver called the CYP450. 90% of our drugs are metabolized through this. We have a pharmacist here, she's shaking her head. So those proteins metabolize a lot of our drugs, and depending on our genetic makeup, we may metabolize the drug normally, we may be a slow metabolizer, intermediate metabolizer, or a rapid metabolizer. So this can affect the way we respond to medications and treatment. It's going to check for 300 drug responses, 300 medical conditions. It's going to compare your medications that you're on right now to see which pathways are being metabolized through, and then it's going to give us clear guidance on what to do. I'll use an example of this, like the statin drugs. They're metabolized. If you are a fast metabolizer of a statin drug, it's not going to be effective. So we could adjust the dose, knowing that would be very helpful. Different statin drugs are also, most of them are metabolized by the very same one, but there are a few that are metabolized by a different one, so we could always pick one where you're metabolizing it normally. Also, if you're a slow metabolizer, you could end up having increased side effects on that drug. This is an example of the pharmacogenomic report that we received. I condensed it. These are several pages. Those are 4 pages put in one. I just put a little bit up there so you can kind of have an idea of how it's going to be reported. It's going to show us medications that we should try to pick an alternative. It's red, normal response, proceed with caution, meaning we may need to adjust it, and then those that they give dose recommendations. And here's an example of an individual who went in, and they're showing that for this person, this medication, this cholesterol medication, we should use with caution due to decreased response. In this case, probably it's a rapid metabolizer. The second one here is saying please use an alternative or decrease the dose, because this one's a slow metabolizer or low activity, so they're going to have increased side effects. And again, here shows some hypertensive medications showing that this individual is all in green. And here it's showing how we respond. Here it's showing the actual gene and your genetic makeup that we're looking at, and then how that you're a normal metabolizer. And then the last page will show you genes and genotype, and phenotype is your expression. So pharmacogenomics, a little more information on this. Right now we have a special till the end of today where it's a $175 one-time fee, or it is included if you have an annual membership prepayment. The normal price is $200. It's going to be available. It'll be $200. We'll still be offering the $200 discount for prepayment. So that's something for new patients. Okay. Very easy. I think that who benefits the most from the pharmacogenomics? Anyone on any medication. And we actually had a patient who had genomic testing, and she had been using ibuprofen, and actually her genetic makeup showed that she probably should not have been using ibuprofen. So it can be even over-the-counter medication. So if you've ever taken anything, it's going to be beneficial for you. It's more beneficial for patients who are on multiple medications. So it is an easy test. It can be done either with a swab or saliva collection. It takes about 2 to 4 weeks to get the results back. And then once we get the results, we include the counseling session where we go over the results and any recommendations. And at the same time, we review the medications and your history and put a plan together. So the last tier is tier 3. This is the comprehensive predictive genomic testing. It includes everything, including level 2, the drug response pharmacogenomics. So it'll look into health risk, wellness, little bit of ancestry and drug response. For heart disease, it's going to look for cardiomyopathies, cholesterol, hereditary cholesterol disorders, hypertension, and clotting issues. It will check for at least 114 genes. Just a little bit of facts: 1 in every 4 deaths are due to heart disease, and 1 in 100 individuals will carry a genetic heart defect. For cancer, it's going to be checking for breast, ovarian, Lynch syndrome. And Lynch syndrome is a missense gene, meaning the repair gene. So we see cancers in different organs, but especially in colon, breast, even renal cancers. So that's something that's really important because it can be handed down to your first-degree relatives. We'll be checking for prostate cancer and pancreatic cancer. 1 in 3 people will get cancer during their lifetime. 10 to 15% of cancers are genetics. Infertility, it also checks for diminished ovarian reserve, polycystic ovary disease, those who are at increased risk for pregnancy, which is interesting that they're checking for MTHFR, which increases someone's risk for pregnancy, but it also increases their risk for heart disease. So some of these can be in 2 different categories, and low sperm count. So 1 in 6 couples will have infertility, and up to 10% of infertility is caused by genetics. We also check for vision in this testing. It does glaucoma. We've had several counseling already where we found patients that have a mutation for macular degeneration. Now, that being said, that doesn't mean they're going to get macular degeneration, but it increases their risk. There are macular degeneration is not reversible, but there are studies that show that certain vitamins can help prevent the progression. So if we know that now, there's something that we can help these patients. And macular degeneration is the #1 cause of blindness as we age. It's more common in females as well. So 1 in 20 people have a mutation that leads to vision loss, and 1 in 1,000 individuals carry a mutation that leads to blindness after LASIK. So this is what's interesting, is that if you get LASIK surgery, there are certain individuals that are at risk for failure, and knowing that would be beneficial. So neurogenic disease, we're going to be checking Parkinson's, ALS, and Alzheimer's. Again, 1 in 200 individuals will have early onset neurological disease like Alzheimer's or Parkinson's. Other genomic health disease, I won't go into details, but it will check for other things. And these last 3 on the bottom are basically anesthetic response, so if you go under anesthesia. It also will give us more information about nutrition. There are some individuals that, depending if they eat a high-fat diet or low-fat diet, some will lose weight with the low-fat diet or have a better response to lowering their cholesterol. It will give us information on food intolerances like celiac disease or gluten sensitivity, and also vitamin deficiencies. For exercises, we do know that there's 2 different types of muscle fibers. We can tell what your genetic makeup is and basically tell you you're going to do better with endurance exercises, or you're going to be doing better with strength training. So we can kind of direct you in that direction. So we'll also be able to give you more information on performance over time. And sleep, it's actually interesting. There are individuals that inherit sleep pattern where it's a low sleep pattern, meaning they only need 6 hours. That's hereditary, and that checks for that. So in other words, most individuals require 8 hours of sleep to feel rested, and there is in the population those that only require 6, and it actually tests for that. And it'll check for other things like narcolepsy, increased risk of, or restless leg syndrome. So in summary, this is an example of an individual who comes in. The first page is going to say, this is a summary of your results. This individual here had no health risk anywhere except where it shows the blue, and he had severe health risk in the cardiovascular section. And then it'll show something like this. This individual had the LDL gene that encodes for LDL receptor. This individual will have increased levels of LDL in the blood, and it is inherited as an autosomal dominant. And so this is a familiar hypercholesterolemia. This individual would be at increased risk for heart disease because of that. So we would start probably treatment at that point. So for the comprehensive genomic testing, right now we have a special going for $575 for a one-time fee, or it's discounted to $400 with your annual membership prepayment. The normal price goes back up to $600. It is also done with a saliva kit available here in our office. It takes about 5 to 10 minutes to collect. It takes 4 to 6 weeks to process. And then we bring you in and also counsel you, so you'll get your genetic counseling here with me. So in summary, we have 3 levels.